Bridgette too. Okay. All right. Well, good morning, everybody. Welcome to Executive Committee meeting for ADDPC on Friday, March 20th at 9:02 a.m. Marcy, would you like to do introductions and roll call?
Sure. We'll start with committee members. So Melissa.
Good morning, Melissa Van Hook, your chair. I am here.
Great. Monica.
Monica Cooper, Self Advocate, Chair of the Grants Committee.
JJ.
Morning, everyone. JJ Rico, Vice Chair for Council.
And Kelly.
Kelly Roberts, member here.
Okay. And we have Jana as a no and possibly waiting on Kathy and Vijette. I have listed. Okay, staff, we'll start with John.
Morning, everybody. John Myers, Executive Director.
Jason.
Good morning, everyone. Jason Sneed, Research and Communication Specialist.
Lonnie.
Lonnie St. Cyr, Fiscal Manager. Good morning.
Michael.
Good morning, everyone. Mike Leva, Contracts and Grants Coordinator.
Sarah.
Good morning, Sarah Roof, Communications Director.
Okay, that's it.
Okay, and you. Thank you.
And myself.
Thank you, Marcy. Thank you so much. Okay, everybody, let's move to agenda item B, our minutes review and approval from January 16th, 2026 for Executive Committee. I hope everybody had a chance to review those minutes. Before I call for a motion for approval, are there any corrections, comments, or notes? Okay. Hearing none, I'm going to call for a motion to approve the minutes as written for Executive Committee meeting for January 16th, 2026. Do I have a motion to approve?
So moved.
Thank you, Monica. Do I have a second?
JJ seconds.
Thank you, JJ. All in favor of approval, please say aye. Aye.
Aye.
Aye.
All those opposed, please say nay. Was anyone not voting? Okay, motion carries. Good morning, Vijette. Good to see ya.
Good morning. Sorry, I'm in Utah and I didn't realize the time changed.
Oh, no worries. Well, thanks for joining us.
Absolutely.
No problem. Okay, agenda item C, our fiscal update with Lonnie.
Thanks.
That.
Thanks for sharing, John.
You got it.
Okay, so the council has received a total allotment of $1,500,684 for fiscal year 2024. The obligation period was through September 30th of 2025, and the council has fully obligated these funds. The council requested and received a no-cost extension for the project period, which now runs through September 30th of this year. There's approximately $3,472 remaining to be liquidated by September 30th of this year. The council has received a total allotment for fiscal year 2025 in the amount of $1,497,000. Sorry, $1,497,106. The obligation and project periods are through September 30th of this year. The council has fully obligated these funds, and there is approximately $478,199 remaining to be liquidated. The final report will be due January 28th of 2028. We are not anticipating a no-cost extension for these funds, so it's going to be essential that we get everything, the work completed by this September. And finally, the council has received the first allotment for fiscal year 2026 in the amount of $500,154. So what you're seeing here is just an estimate. The obligation and project periods are through September 30th of 2027. The liquidation period is through September 30th of 2028. We have been told to expect level funding, but this is still uncertain as we have not received our notice of award yet, unless John is holding out on me. These funds will be used primarily for 2027 projects, so what will fall into the next 5-year state plan. These projects and the amounts are still being determined as part of the 5-year state plan. So just know things are kind of flexible and unknown at this point. So consider this being put in pencil. Things may change, but this is kind of our best estimate of where things stand right now. Any questions on this sheet? Okay. Moving on to the next one, I'll just keep this one simple. The sheet shows all the current projects funded by the council. All the new and continuing projects are reflected. Nothing really to report, nothing new, nothing changed. Paying our bills. Any questions on this sheet? Okay, and the final sheet is the budget recommendation. And again, this one is very much, at least the fiscal year 26 column is very much in pencil. Right now, what you're seeing for fiscal year 2026 will be the work plan projects for 2027. The sheet reflects the projects outlined for the fiscal year 2026 work plan as well. And the new projects for the 5-year state plan. The funding year is the year prior to the project year. So, you know, we're currently in 26, but we're spending fiscal year 25 money. So we're kind of working in the middle column as far as the projects that are being completed right now. For fiscal year 2025 funds, they're used primarily for the fiscal year 2026 work plan. The administrative budget has been increased to reflect the work being done with the comprehensive review and analysis and the 5-year state plan development. And again, this sheet is very fluid at the moment as we don't know what our 2026 funding is yet. And the state plan development is underway. So yeah, what's in 2026 kind of reflects the existing projects that we anticipate moving forward into the next 5-year state plan. It's not comprehensive because we've kind of identified a few additional projects that we'd like to use. Just know at this point, there's about $100,000 that we're still trying to either reallocate or find a new project for. So again, we're still open to ideas moving forward as to new projects for fiscal year 2027, which will be our $26, which we're still waiting on. Sorry about that. It's times of uncertainty right now. I don't know if our network partners have their final notices of award yet, or if we're the only ones still waiting. JJ, Kelly?
We have not received our money. Word on the street is within the next couple weeks, but usually we're last just because we get 4 grant awards from ACL. So usually we're last amongst the 3 of us. So, but curious if Kelly's got their money.
We have our funding, yes.
Full funding?
As far as I know, we do.
Okay. Because we do have 500,000, we just don't have the full award amount, so.
I will verify that right now. You're making me
Oh,
question.
no, it's okay. It's fine. I was just curious, but thank you guys.
Thank you.
Any questions? That's it for me.
Okay, thank you, Lonnie. All right, agenda item D, our executive director report with John.
Good morning again, everyone. And Kelly, I don't know if you can see me, but I wore my best aloha shirt in your honor today because I know you're in Hawaii, and you know that's important. I'll try to be brief because JJ, I understand there's some basketball game going on today, later this morning.
We got an hour or so. So as long as your report's not over an hour, we should be okay.
All right. Well, my alma mater is about to tip off any minute now, so I'll speed through this. Yeah.
Go for it.
Touching on Lonnie's point about the notice of award, no, we do not have our notice of award yet, and I just checked, 2 minutes ago. So we are still awaiting that. We have been told by NHEDD that we should expect level funding, that there are no surprises in our future. So if that's the case, then we will have a budget or we will have an award amount similar to what we got in fiscal year 25. But until we see it on paper, of course, we're always, a little bit on edge. In any case, we do expect to see it fairly soon. We actually were told that we could probably expect it by the end of last week, and it didn't arrive. And at the end of this week, and it still hasn't arrived. So we just don't know anything more right now. I will be in Washington, D.C. next week, and I will be having a meeting with some folks at ACL. So I'll ask them. If we haven't received it by then, I'll ask them if they know anything more. One of the things we do know, I think it's a reality for all of us who receive funding through HHS. They let go a lot of their staff, a year ago, and the majority of those staff were program related, were related to the financial side of the programs. So it has slowed things down. They brought some of them back, but not as many as they had, and it means that getting NOAs out the door and getting other financial stuff out the door has really, really gotten bogged down. So I don't think we have any reason to panic. I just think we're experiencing the impacts of the staffing cuts that were made last year. So related to that, the fiscal year 26 federal budget, as I think everybody knows, has primarily been passed and signed into law. The one thing that is still hanging out there is the Department of Homeland Security. And the big news from that is what's all over the news is how that's affecting TSA agents at airports. And so if you've traveled lately, you probably know that the lines are a little bit longer. With regard to HHS has been funded. And so that means that the money that should be coming to us should be coming to us. And we would expect to see that, in due course. There are no other big surprises in the federal budget for this year. There were no significant cuts to any DD network programs, no cuts at all, to my knowledge. And Kelly or JJ, you could tell me if that's not true. But in terms of what comes through ACL, everything should be just as we expected it to be. So we are now looking forward to. I guess I could say we're looking forward to what's going to come through the fiscal year 27 budget process, which is currently beginning because Congress is supposed to take the president's budget proposal, which has yet to be shared, and then do what they do and come to an agreement so that the new budget can be signed and in place by October 1st. Obviously, that hasn't been the case in recent years. There's always been a continuing resolution. We hope that that's not going to be the case. We hope that there is an opportunity to have a federal budget in place by October 1st, but we don't really hold our breath on that. So we are in the process right now. There is a Dear Colleague letter going around in the House. Representative Brzezinski from Illinois, who's been a longtime supporter of DD councils, has circulated a Dear Colleague letter. I think similar letters are probably going around for the USEDs and for the PNAs to ensure that there is strong support for continuing funding for us into the next fiscal year. Representative Ansari and I think Representative Stanton from Arizona are signers on that Dear Colleague letter. And so we've worked our relationships with those offices to make sure that they are on. We're hoping to get Representative Grijalva to sign on to that as well. She's new in office, and our relationship with her is not quite as strong. But I think probably DRAT has a good relationship with her office, and perhaps is persuading her at least to sign on to the PNA letter. Otherwise, no big news on the fiscal 27 federal budget right now. It's just very early in the process, and we're encouraged to see that members of Congress are standing behind the DD councils and the other DD network programs as they begin this budget making process. One thing that I would note, and I don't know if I mentioned this at the January Executive Committee or Council meetings, there was talk about changes at HHS, and particularly the Administration for Community Living, and folding it into the Administration for Children, Families, and Community, making it all just one big program. When the Senate passed its budget, which ultimately then was reconciled with the Houses and went on for the president's signature, the Senate included a statement specifically saying they were not approving funding to allow for the merger of those two entities, which means the Administration for Community Living remains a standalone entity. It will not be folded into ACF to make ACFC. Sorry for all the acronyms and abbreviations. But ACL will remain on its own, at least through this fiscal year, unless some, at least through this fiscal year. And if there is some change in fiscal 27, we'll see that. But at this point, it looks as though the Senate is solidly behind keeping ACL its own agency. And that's a good thing for us because what ACL does and represents in many ways is unique and distinct from what ACF, the Administration for Children and Families, does. So it's generally speaking, it's a lot of words, but it's a really good thing for our programs. And so we're pleased to see that. The Disability Policy Seminar, which many of you have attended in the past, is next week in Washington, D.C. Sarah, Ruth, and I will be going to that. Sarah has really done yeoman's work trying to set up the appointments for this. We don't have every office finalized at this point, but we are significantly on our way. It's been more challenging this year to get office appointments than any year that I remember, and I've been going to this thing since 2014. So I think for a variety of reasons, many of which are probably obvious, the congressional offices are very, very busy right now, and they're doing their best to fit us in. Sarah and Melanie Mills from the ARC of Arizona are working the phones, and I think we're ultimately going to be able to see almost all, perhaps all of our congressional offices next week. I want to point out there will be no council members going this year, and that's for a variety of reasons. One is financial. We still don't have our NOA, and when the information about the policy seminar came out, we were very concerned about where things stood with the federal budget and so forth, and so we didn't put out the call to council members, and it largely was just because there was so much uncertainty around our budget. Now we feel a little more certain about our budget, but it was just too late in the process to work everybody's paperwork and make sure that everybody could be. Any council members anyway that wanted to go could be certain that their travel plans would be made. In addition, we have the largest group from Arizona ever. We have 28 people going from Arizona. Last year we had about 22, and that was the largest up to that point. With as many people as we have, with almost half of those coming from the LEND program at the University of Arizona, various other provider and advocacy organizations, it's already going to be very, very difficult for us to manage appointments and make sure that everybody can fit into the office spaces and get to see the people they want to see. So it's a mixed blessing having that many people going. Certainly shows that advocacy in Arizona is picking up, but it also represents a logistics challenge for us. So Sarah and I will be there from the staff, and if circumstances change next year, if we know earlier in the year what our financial situation is, and we can get people registered in time, then we will offer the opportunity to council members as well. So in any case, thank you to those of you who have gone in the past. We really appreciate it. I think the representation we have this year between the council, the ARC, Ability 360, Arizona Autism United, the LEND program, and the Sonoran Center at the University of Arizona, we've got a really good, and some provider agencies from here in the Valley. We've got really good representation, and I think we'll be able to impress upon our elected officials the importance of disability issues in the year ahead. The council state plan is moving forward very, very nicely. I think we have reached the end of our public comment period. As of yesterday, our public comment period closed, and I have not been told, well, the last time I spoke with Megan Donahue at IHG was last week, and up to that point, we had not received any comments that would require us to go back out for a second round of community input. And I've not been told anything this week that would indicate we are going to have to do that. Megan will be providing an update on the whole process at next week's full council meeting. And our anticipation at this point is that we are in a place where we can finalize all of the elements of the 5-year state plan, as well as the particular elements of our annual work plan for fiscal year 27 and fiscal year 28. It looks like we are going to have to submit both years with the work plan when we send it in August. So we are feeling, I think, very confident about that. The staff have done a lot of work putting together a draft of the work plan. We had a work plan review committee meeting last week. and members of that committee provided some additional input. We're not through that process of finalizing the annual work plans yet, and the committee is going to be meeting again in the fairly near future. And so there are a lot of things that still need to be done, but things are moving according to schedule, and we feel, I think, very good about that. We have talked in the past about a number of changes to the eligibility and assessment tool and the process that Access and DDD are going to go through. This is all related to the supplemental funding bill that went through the legislature last session, the 25 session. We are still awaiting a final version of what that revised tool and what that revised process are going to look like. We have been given no indication from DDD or Access when we can expect that. I did have a conversation with Zane Garcia Ramadan at DDD a couple of weeks ago, and he said, I wouldn't be surprised to see it tomorrow. On the other hand, I wouldn't be surprised to see it a month or two or more from now. So even internally, it appears they don't know exactly what the timing is going to look like. What we do know is that many of the things that were implemented back on October 1st of last year, when this new process was supposed to take effect, those things are probably going to remain. And as usual, JJ, I think, has a better handle on the legal issues involved with that. But we do understand from Access and DDD that many of the time or some of the age-related requirements are going to be a part of the new tool. As you probably remember, the tool was put into place on October 1st of last year. And then in mid-October, the governor put a halt to that because she realized that there hadn't been adequate community input on this, and there needed to be a special rulemaking process. So that special, the input period for that process took place. Access subsequently had to review all of the comments that came in, more than 4,000 comments, and issue a whole new revised structure for what this process is going to look like. That's what we're waiting for. We're waiting for that revised structure, and we still don't know when it's going to take effect. But as soon as it is, we'll make sure that everybody knows. We just don't have any timing. JJ, was there anything more from the legal side that you might want to add to that?
Not really. I mean, I think you did an excellent job summarizing kind of where we're at. We don't have any additional information, and from the legal side, I guess we believe the notice, obviously the original process wasn't done right, and so they had to reopen and do the notice kind of process that they did this time in the emergency way. But we do anticipate still seeing age-specific cutoffs or limitations. So I don't think they went back and reassessed and decided not to do some of what they've proposed. It might look a little different or sound a little different, but I think the intent is still to reduce hours of services. And once we see it at DRAZ with our partners, we'll better be able to analyze the legality of what they're going to try to implement. There's concerns on that, and then also concerns on how they implement it, and how they're actually going to roll that out, with individual members and people, and the use of support coordinators, et cetera. But I guess more to come. Stay tuned. I don't think this is necessarily over, and there is going to be a lot of cuts that I think are going to impact families that all of us need to work together to message, and then also to gather stories, and then also if there is any legal arguments to be made, to try to find families that highlight legal concerns if there turn out to be some legal arguments that need to be relayed to the state. So don't have much more than that, but I think, John, your summary was really good.
Great, thank you. One key thing that I probably should point out, and I think we've stated it before, the changes that are going to go into effect will primarily or perhaps exclusively affect the pediatric population, the birth to 18 or birth to 17 age group. And a lot of this has to do with parents as paid caregivers program, and the increased utilization of services that have resulted from that, and the costs that have resulted from that. All of this is an effort to try and reduce the cost to the state for DD services, and so it's going to disproportionately certainly affect the parents of minor age members, and so that is gravely concerning, I think, to all of us. And And what we also, well, what the word on the street is that they're going to put this new process into place. There will be an initial, for lack of a better word, an initial appeal process if parents are not satisfied with the initial answer they get from DDD regarding authorized hours and authorized services. But once that initial appeal has been resolved, there will be no additional appeals process. Now, again, I'm not a lawyer, so JJ maybe could answer that. But what we've been told is that you got one shot to appeal, and if you don't get what you want, you're basically stuck with what DDD has or Access has told you can get. So that is additionally concerning because it does seem to have some risks associated with it. So lots more to come. I won't belabor it anymore, but we'll keep you apprised of what happens. And it is certainly going to represent sort of a watershed moment when it comes to DD services in Arizona, and perhaps not in the most positive way. Let's see. The Rural Health Transformation Grant. I've spoken about this a little bit in the past as part of HR 1 last year. Massive cuts to Medicaid funding. Congress tried to ameliorate some of that by establishing this Rural Health Transformation Fund that states could apply for up to $200 million a year for 5 years to help offset some of the reductions in rural health agencies and rural health facilities. Arizona got $167 million of the $200 million it applied for. We are, I think by most estimates, significantly behind the curve when it comes to getting RFPs out for utilizing those funds. The funds each year have to be expended by December 31st, and we are now we're midway through March, and the RFPs have still not been issued for agencies wanting to utilize those funds. So the governor's office and Access are jointly responsible, from my understanding, to get the information out and give organizations, agencies, healthcare facilities, whatever, an opportunity to put that money to good use. And so we're a little concerned. I would say I am a little concerned, and others may know otherwise. But we're just we're not as far along as we thought we would be. We're not as far along as we were initially told we would be at this point. So again, as more information comes in, we'll let you know. But we all know that there are any number of rural communities in Arizona that are going to be affected by the cuts to Medicaid and that could just sorely use the money that's available through this fund. So we want to make sure that it gets to where it needs to get, and that members, individuals with disabilities in particular, have an opportunity to utilize the money that's going to be there. So more to come on that as well. The legislature, as we all know, is still in session. Lots of things still up for discussion. I would say the potential negative effects from legislation this year are, I think, in my estimation, minimal, largely because even though many bills are moving through that could adversely affect the disability population, in virtually every case, we would expect the governor to veto that legislation if it gets to her desk. There are a number of bills around voting and elections and the way elections are handled. And we know there's an effort at the federal level with the Save America Act to restrict the opportunity for Americans to vote, to place additional burdens on Americans in order to cast their ballots. There are some efforts in Arizona as well to change the process of elections and to limit voting opportunities. So, some of those bills are moving through. They are sponsored by members of the majority party, but we don't think they're going to receive the governor's signature if they land on her desk. There are a couple of other bills moving through related to SNAP, the Supplemental Nutrition Assistance Program, and TANF, Temporary Aid to Needy Families, and Access eligibility. All of these are bills that will require more frequent reauthorization for people to continue receiving those benefits. A lot of people with disabilities receive SNAP or TANF, and obviously are members of Access, whether they are DDD members, All-Tex members, or just receiving other healthcare services through Access. So all of these bills could make it much, much harder for individuals with disabilities to maintain their services through these various programs. And so, again, these bills are moving through. they are sponsored by and supported by members of the majority party, but they are unlikely to get the governor's signature if they land on her desk, which I think is good news. But you know, we have an election this year for governor. We don't know who's going to be in that office for the next 4 years. So I would say even if these bills are killed this year or vetoed this year, we are likely to see them resurge again in 27. And you know, once again, it's a way to save the state money, and it's a way to cut down on our expenditures on these safety net programs. Melissa?
Yeah, Vijay had a question in the chat. She asked, do we know how other states are using their rural health transformation funds?
Well, I do not know yet. I've heard little sprinkles of little comments from other executive directors of state councils, but to my knowledge, most of them are not heavily involved in the programs in their states. They've mentioned a few things to try and get money out, but I don't have a lot of details on those things. I can certainly look into that. Maybe by next week's council meeting, I can have a little bit more information to share with everybody. There may be some great examples out there that I'm just not aware of, so I'm happy to look into that.
Thank you. I was just wondering because I'm anticipating that once Arizona rolls it out, it'll be a quick turnaround to apply. So I'm wondering what we can do to help strengthen any applications in the rural areas. And sometimes when these happen, I see that they mimic other states. So I don't know if we have a state that we perform similarly to that we can kind of anticipate what Arizona might do as well.
Yeah, great point. Great point. Let me do some digging. I'll reach out to some similar states and see what they're what they're envisioning or what they're involved with at this point. Okay. There is a particularly important bill, I think, moving through Senate Bill 1179, which is the group home monitoring program that Disability Rights Arizona oversees. That bill, I believe, is still in process. Again, I might have to turn it over to JJ to provide some additional details, but as you may recall, several years ago, the legislature put into place a monitoring program for group homes that serve individuals with complex needs. Disability Rights Arizona has been running that program and providing updates to us and to the community, as well as reports to the legislature and to a special committee chaired by Senator Dunn, related to vulnerable adults. It's a, I think it's a great program. We all understand that the burdens on group homes are many, and they have a heavy responsibility. Having one more reviewer or one more set of reviewers come into their facilities often doesn't sit well with them, and the Provider Association has pushed back quite a bit on this continuation bill. But it is an important program to ensure the safety and well-being of members, especially members with complex needs. It is an important bill because, we need a lot of eyes on this system. We know that there are things happening that shouldn't be happening, and we know that not every provider is being held to account for the way they're operating their businesses. So what DRAZ has uncovered over recent years has been eye-opening, and we need to continue. I think we need to continue as a state to support that program. I am hopeful that bill is still working its way through. It did move out of the Senate and get transmitted to the House. So, JJ, I would turn it over to you again if there's anything more to report on that.
Great. No, thanks, John. I think appreciate the support, and you're 100% right. It is moving. It passed through this week through the House side of the Health and Human Services Committee. We were able to testify in support and also have a parent who testified about the death of her son in one of these group homes and the impact that we had in terms of the investigation we conducted and how she felt she was treated by us compared to when she brought up the incident to the state. So we do find, unfortunately, still uncovering some bad actors out there. So there's most definitely a need. The providers lobbyists have come out, and a number of the providers have entered their opposition against the bill. Their expressed reason is that, it's a tight budget year, and this would cut into the overall DDD budget, which it would, to the tune of $1 million versus the overall budget of DDD, which is significantly more than that. But to John's point, additional oversight when we're still uncovering some really horrific incidents. And then also learning that the state's current monitoring system is not effective or to the degree that we think it needs to be to really see if members are being cared for properly and staff are properly trained to serve people with complex needs. So we're hopeful. I have a call with Senator Dunn next week to see what last steps we need to take to make sure that it gets over the finish line. The program will still exist. This bill, a slight amendment, is just to continue it, make it still continues to be a permanent program, no longer a pilot project. And then we obviously have to also get the funding. So we're almost there. It's a process, as all of you know, and John reports out very well about legislation. It takes a lot of steps to get it over that line, but we have had members of the community come out and support. If any of you are individually or as an organizations in support of the program, you can always enter your support through the request to speak system, or contact your legislators, your representatives, and let them know that this is an important program to you. So appreciate the floor, but we're almost there. And then hopefully the next meeting that we'll have all together, I can report out that it's passed, and then we're subject to a budget process, which will obviously be part of. And Senator Dunn's been great. So if any of you, I don't think anybody on this call might have Senator Dunn as their senator, but he's continued to champion this even after Representative Longden's left office. So, and disability is not kind of his area, but he's really championed this. And so you have to appreciate those senators, representatives who take disability issues seriously and advocate for it when they see something that needs to be done. So a lot of recognition, kudos needs to go to him for continuing to do this, because it would have been easy just to say, oh, that's not my thing, I focus somewhere else. But he's continued to know that it's important. So we appreciate him. So thank you, John.
Yeah, thank you. Last couple of things related to the legislature that I would mention. There's a bill moving through, House Bill 2700, which would establish a technology first study committee here in Arizona. And this is important because of the work we're doing on our Bridging Aging and Disability Networks project. One of our work groups for that project is specifically focused on improving access to assistive and enabling technologies for individuals with disabilities to support independent living. And a technology first designation, if the state moves in that direction, would largely focus on improving availability of assistive and enabling technology to individuals with disabilities. So we are pleased that is moving through. It passed the House. It's being heard in Senate Health and Human Services, Appropriations, Transportation and Technology. I'm sorry, on the Senate side next week. And it is one of the rare Democrat-sponsored bills that is actually moving forward in this session. So it is pleasing. It's actually it has bipartisan support. So it was just sponsored by Democrats. So it is pleasing to see that moving forward. And if it does, then that could provide some additional momentum for some of the work we're doing on our bridging project. Lastly, a couple of things that would also be, I think, beneficial for the disability community. A couple of bills that were sponsored by Senator Fincham, who is a surprisingly strong supporter now of the DD service system. He introduced a bill related to special education and parent complaints, Senate Bill 1754. It would provide for much greater transparency and much greater accountability within special education programs around the state, addressing complaints by parents related to services, related to rights, adherence to their civil rights and their education rights. It is moving through. It is going to be heard in the House Education Committee next Tuesday. So that's encouraging. I think if it passes, we'll go many steps farther in making sure that the rights of parents and the rights of students are addressed in the special education programs around the state. As we all know, with Arizona being a local state, a local control state, it is often difficult to have consistency from district to district or even from school to school. And so this, I think, would be an improvement. And finally, although this is unlikely to really go anywhere this year, it is at least a good sign. It's a good signal to the community that there is support for the provider service, the provider system. And that is a bill introduced by Senator Fincham for a $45 million increase in provider reimbursements for the coming fiscal year. The state budget, unfortunately, is so tight right now that even the Provider Association doesn't think this really has a shot at getting built into the final budget. But the bill itself is moving through, as with every appropriations bill, as mentioned by JJ just a minute ago. Even if it passes both chambers, it then has to get folded into the budget negotiations. So it probably will not go anywhere. It's a large chunk of money for the state, but if both chambers pass it, at least it indicates that they are supportive of the DD system and they understand that with providers not having received a rate increase for at least the last 6 or 7 years, the time has come that there really needs to be something done to remedy that situation. So we'll see where it goes. Anything is better than nothing, and even $45 million, unfortunately, even that large amount doesn't fully resolve the reimbursement problem for providers. They're still struggling in many cases, but again, it would be at least a good sign. So we'll have more on that as time goes by. The last thing, and thank you for being patient with me, the last thing I would mention is a really fantastic event we had a couple of weekends ago in Avondale. It was our first ever outreach event, resource event focused on the Hispanic community here in the Valley. And Jose and Gabby Orozco from Ideal Care, Gabby, of course, a council member, were really instrumental in helping to put the event together. Sarah, Jason, Mike, Leva, and Alexander Martinez, one of our MSW intern for this year. They collectively did an incredible job of putting together this event. We will have a report on it from Gabby and from members of the staff next week at the council meeting. Because it was such a successful event, and one that I think we will do our very best to replicate in coming years. We have talked a lot lately about trying to do a better job of reaching the Hispanic community, and we realize that just one event in the Valley doesn't do justice to the needs around the state, but at least it's a start. And we couldn't be more pleased that we had a council member who is well respected within that community, being so instrumental in putting this event together. So as I said, we'll have more information on that next week. But I wanted to let you know that we executed that event and did a really fantastic job. Again, all credit to Sarah and Jason and Mike and Alexander, our intern. They just did fantastic work to put that together. So that's it. I'm happy to answer any questions. I know I've talked a lot, but if you have any questions about these items, feel free.
Okay, I don't hear any questions. Thank you, John. And thanks to the staff and Gabby and her husband for that event. I understand it was really terrific. So, and I'm really happy we're going to present on that. We'll get to hear about it next week for full council. So thank you so much. Okay, moving on to agenda item E, our full council agenda for March 27th. Looks pretty similar to today, except we have committee report outs, a little more on our state plan, of course, and activities. Okay. Right. Any questions on the agenda? No?
I would note, as you look at the committee reports, you'll see that only 2 committees will be reporting, and that's because those are the only 2 committees that have met recently.
Yeah.
So.
Yep. Been pretty quiet. It's all right. Well, there's a lot going on. It's just committees haven't needed to meet. So, okay, thank you. Agenda item F. Are there any announcements? So quiet. Get to that basketball game. Okay. Agenda item G is call to the public. I don't note any public on this call today. So moving on, agenda item H, adjourn. I'm going to adjourn this meeting as of 9:46 a.m. Thank you, everybody, for being here today.
Thank you. Have a good weekend, everyone.
Thank you,
Better,
you too.
Melissa.
Thanks.
Bear down.
Thank you,
Go
Kelly.
Cats.
Thank you.
Thank you.
Thank you. Let's see.
All right.
All right.
Bye.
Bye, John.
Bye-bye.